webinar tonight. My name is Janet McLean, and I'm with Family Caregivers of BC. I'm the lead for education and engagement, and we're thrilled to bring you this webinar tonight about adding a pharmacist to your care team. Just a little bit about Family Caregivers of BC before we get started. We are a nonprofit dedicated 100% to supporting family and friend caregivers. And we were the first of our kind in Canada. We've been around for 29 years. And for the last 8 years, we've been serving all of British Columbia, and the last 5 years with Ministry of Health funding as part of the BC Ministry of Health Patients as Partners initiative. And that initiative allows us to do things like this webinar, and we're just absolutely thrilled to be able to bring these webinars to folks. We do a whole bunch of different things at Family Caregivers of BC, and again, as the name would imply, mainly for people within British Columbia, but we do have a lot of people attending these webinars from different parts of the country, which is lovely. The main three things that we do are we offer caregiver support, caregiver education, and we engage caregivers in collaboration with the health sector. In terms of caregiver support, we operate a toll-free call line from anywhere in British Columbia, Monday through Friday during business hours. You can call our line and we will help you navigate, we'll help you find resources in your community, we'll direct you to support groups, and we have a lot of resources on our website, so that's why I've included the website address here, articles and recorded webinars such as the webinar from tonight. In terms of education, we offer these webinars, and we also have all the resources I've just mentioned, and we attend events and do things in the community around the province. Health sector collaboration engagement, we do engage family caregivers who have been on their own caregiving journey to assist us by attending meetings and representing family caregivers at different tables. We ask them to help us look at materials that we're producing and really provide that caregiver lens. So if anyone is interested in doing that, you can go to our website and you can find a way to just connect with us about your interests. That would be fantastic. Oh, and I forgot to mention that we do offer Caregiver 101 coaching sessions, and Wendy, who is one of our presenters tonight, is one of our coaches. So it's a fabulous service and really provides more in-depth help to caregivers who are in. We're thrilled to have two presenters for our webinar tonight. Jason Cridge is a native of Victoria and owner of Cridge Family Pharmacy, and for those of you from Victoria, you'll know that Jason's family is very, very well known in Victoria for a number of different community services. Cridge Family Pharmacy provides retail pharmacy and specializes in home care services, and throughout the webinar, Jason's going to be telling us a little bit about a couple of the innovative advances that they've made through Cridge with dispenser, medication dispenser, and also with community-based med administration programs. So really looking forward to hearing about those, Jason. And yeah, the Cridge Family Pharmacy is in Victoria, but I think, you know, your communities and the pharmacies in your communities will have some of the same services, and we're really hopeful that tonight's webinar is going to help you understand more about the role of pharmacists and how you can use them. So Jason, just thrilled to have you. I mentioned Wendy, who you can see on the screen, and Wendy is a consultant with our organization, Family Caregivers of BC, and brings almost 20 years of experience as a gerontologist to her role. Wendy runs her own company in the Comox Valley, but she does our caregiver coaching calls and also participates in many of our other programs and services, including writing an article in the Inspire Senior Living magazine that you may have had occasion to read. So we're just thrilled to have both Wendy and Jason here tonight, and I think it'll be a very informative webinar. I'm going to turn it over now to Wendy. She's going to walk us through the learning objectives for tonight, and we're going to get started. So over to you, Wendy.
Thanks, Janet, for the introduction. It's nice to be part of a webinar again. This topic is quite a big topic for many of the family caregivers that end up calling the support line, but also often the case in our coaching calls. It comes up quite a bit around understanding, safety around medication use and how best to develop those collaborative relationships with key healthcare providers. Of course, pharmacists are one of those incredibly important resources for family caregivers. So tonight, what we're hoping that you're going to walk away with is that you have a better understanding of what role the pharmacist plays as part of your care team and support team from the caregiving perspective, but also for the care recipient. Jason's going to walk us through to help us better understand how fair pharmacare operates, as well as third-party insurance coverage. That's often an area that many caregivers just aren't sure. Things might change, and I'm sure Janet and I are also going to learn a fair amount as well. Also understanding how best to reduce, possible drug interactions that can lead to hospital visits or illnesses or exacerbating some of the symptoms of disease. And also to understand, how do you become an informed caregiver so that you can become a better advocate in terms of ensuring that the person you're caring for is receiving the best possible care, but also to understand what to look for in terms of areas around medication misuse, understanding how the medications should be working, and at which point understanding how medications can actually interact with each other and also cause some areas of concern as well. So that's what we're hoping you're going to walk away with tonight. One thing I will say is that it's wonderful to have a pharmacist available to us, and so as much as possible, we're going to let the expert, Jason, provide as much information as possible through tonight. So we're super excited. I think I can go. Oh yeah, I can do this myself too. Okay. So why are we even having this webinar? Well, essentially, what we find, especially with a more elderly population or individuals who do have chronic illness or acquired brain injury or mental health, is that with those, the idea of adverse drug reactions tend to increase. In particular, we look at the primary reason for up to 2/3 of all hospital admissions and emergency room visits in Canada. And the other, I think, important piece, which I'm sure Jason's going to speak to, is that these adverse drug reactions in many instances can be prevented, and that's usually through good information and education on how best to manage medications. As we mentioned earlier, seniors are at greater risk for these adverse drug reactions due to the fact that they typically take a higher number of drugs. There's often a higher prevalence of certain chronic conditions, and then age-related changes in the body can also affect how medications are absorbed or how well they can function. So I'm going to pass it over here to Jason and have him jump in.
Great, yeah, thanks for the introduction, Janet, and thanks for that introduction, Wendy. I'm Jason. I'm a pharmacist, and here to talk to you tonight about pharmacy in general, what your pharmacy can do for you, what your pharmacist can do for you, and making sure that you're taking full advantage of all of those services to make your life as a caregiver as easy as possible. So on this slide, just showing a few differentiations between where your physician's responsibility falls and where your pharmacist's responsibility is going to fall. So, a lot of people don't know what a pharmacist does or who their pharmacist is until you absolutely need them. So most people go their lives, through their 30s, 40s, and 50s, never needing to talk to a pharmacist. They've been seeing their family doctor their whole lives, and, they get prescribed a high blood pressure medication, and suddenly I'm the guy that you're seeing 4 times a year, if not more. So basically just trying to get you to know how to best utilize me and your pharmacist in your community. So we have, on the physician side, physicians primarily are going to be assessing and diagnosing conditions and prescribing medications if and when appropriate, or non-drug therapies for those conditions. And your pharmacist on the other end is going to be filling and renewing those medications. So every time we fill a medication, we're determining whether it's a necessary medication, it's effective, and it's safe for you, and if you're going to be able to take it properly. Physicians are going to be keeping an up-to-date record of all the prescriptions you're currently taking. And the pharmacist side, we're maintaining an overview of all medications from physicians and specialists. So your GP might be prescribing 3 medications to you. One specialist might be prescribing 2 medications, and then you have another specialist prescribing 2 others. Sometimes the GPs or the other specialists aren't even aware that you're taking those medications. So it's important that we're there just to, play point and make sure none of those medications are interacting with each other, or those aren't causing untoward side effects that you're being prescribed medications to remedy. Your physician, furthermore, is going to be keeping record of any hospitalizations and medical changes you have. And then we're going to be basically reviewing side effects with you and looking at change medications, and also making sure there was no accidental change when your prescriptions are being re-prescribed. And then your physician, furthermore, is just going to monitor you and adjust for your prescriptions, and then we can suggest medication changes and respond to physician requests for time-sensitive changes. I know that's a lot of information, so what I think I'm going to do is just start off with, what type of knowledge do pharmacists have, and where are we trained, and what are we trained in, and who regulates us. So pharmacists are, so right now pharmacists need at least 6 years of training, and every pharmacist that's graduating today is graduating with a doctorate of pharmacy. There's 5 to 7 pharmacy schools in Canada. After we graduate, we are licensed through the Pharmacy Examining Board of Canada, and then subsequently the BC College of Pharmacists. A lot of people ask, what do we learn in 6 years in school? And to be honest, it's quite a lot. So we spend time learning every possible disease state, or the vast majority of them anyways. And then we focus a lot on the types of medications that are prescribed in those disease states, how they can negatively impact other disease states, and then also how they can negatively impact other medications. In your typical pharmacy, you're going to have about 400 different medications that are being dispensed on a regular basis. And pharmacies typically have patients taking around 2,000 different types of medications in their pharmacies. So 400 we carry at any time, and then an additional 1,600 we're going to be ordering in for patients as they need them. We can switch to the next slide here. So, taking all that into perspective, how are you going to best utilize your pharmacist? And I think what's really important is that we start with the cost of medications. So about 14% of British Columbians have either not filled or hesitated to fill their medications because cost is a factor. So right now we've got a bit of a patchwork system in BC for medication coverage, and every prescription as it gets prescribed in BC gets submitted to Pharmacare. Pharmacare is the BC Provincial Drug Insurance Program, and everyone's probably heard of Pharmacare. Nobody has any idea of how it works. So Pharmacare will pay for every British Columbian prescription subject to income-based deductibles. So when you've hit 1% of your net yearly income in medication expenses, you will get 70% of your drugs covered. And then when you hit 2% of medication expenses of your net yearly income, you'll be 100% covered. So a lot of people don't know that, and don't adequately use Pharmacare, and then eventually run into cost concerns in and around their medications, preventing them from filling them and preventing them from treating their condition effectively. So I just wanted to see if we have any questions here No? Okay. If anybody has any questions, feel free to just hop in. I'd like this to be a bit of an interactive webinar instead of me just talking for the next hour. So feel free to ask questions as you have them.
So, Jason, it's Janet.
Hey, Janet.
I know that you're going to be going into a bit more detail on the Fair Pharmacare, but I'm just curious. How would people know if they're like you said some people don't seem to know about it. So how would they find out that they're missing out on something like that?
So as an example, MSP, or the Medical Services Plan, is an automatic plan for everybody in British Columbia. But Pharmacare is a separate plan, and people have to opt into it. And a lot of people don't know you have to opt into it. And you just have to opt into it once in your life. So that opt-in can be done through just a phone call to the Ministry of Health. If you Google the Pharmacare line, I believe it's 1-800-663-7100, but don't quote me there. Called it a couple times in my life. So all you have to do is call Pharmacare and tell them that you want to opt in. So Pharmacare then will ask you to sign a consent that they can access your income tax records from the Canadian Revenue Agency every single year. And through that access, they're going to be calculating your deductible.
Okay, thanks.
Yeah, you're welcome. So unlike other third parties, you don't have to submit your receipts to Pharmacare manually. Every pharmacy, as we run prescriptions, we're automatically submitting them to Pharmacare. And Pharmacare is telling us whether or not they're going to accept or reject that cost. Another thing, too, is a lot of medications aren't covered under Pharmacare. And that's not immediately prevalent to the patient at the time. And there isn't a lot of optics in and around pharmacy billing from the patient's perspective. So it's really important to ask your pharmacist that question. Are my medications going towards my Pharmacare deductible? Or do I need a special application or a special authority to get these medications covered? Because an unfortunate surprise for some people is they fill their medications throughout the year expecting that they're going to be hitting their deductible, only to later find out that they didn't have, some of those medications aren't benefits through Pharmacare and therefore aren't going towards the deductible. So there's quite a bit of knowledge in and around the medications that aren't accessible by caregivers, and it's really your pharmacist that's going to play that main role in making sure you're taking full advantage of Pharmacare.
So, Jason, just one other quick question. So in terms of the application piece, do I understand correctly that sometimes the physician also needs to, or they can be another individual to connect with to have them fill in, or to at least call in with the application or giving it the sign-off?
So yes and no. So for regular Fair Pharmacare, which is the income-based deductible, which is what everybody's eligible for, you can opt yourself into that. But then there's specialized plans through Pharmacare that require certain medical conditions that your physician will have to apply for. So there's certain ones are Plan F. So if you have cystic fibrosis, your physician can make an application to Pharmacare. All your medications at that point are 100% covered. There's also Plan G, which is the mental health plan. Once your physician makes an application for that, all of your mental health medications are 100% covered. There's also Plan P, which is the palliative plan. And again, your physician has to apply for that, at which point your medications are 100% covered. So what I was talking about previously is just Plan I, which over probably 95% people are going to be utilizing Plan I in comparison to those other plans. They're less commonly used for sure.
Right, and then with the medications that aren't covered under Pharmacare, is it only through the pharmacist that patients and caregivers can ask the pharmacist for the special application, or is that also done through the family physician?
So yeah, so of medications that aren't covered through Pharmacare, there's two different types. So there's non-formulary medications. So those are medications that will never be covered regardless. They could be really expensive brand name medications. They could be medications used for only an aesthetic purpose. Maybe they have minor clinical benefit to patients, and the government decides not to pay for them for that reason. Just the the return on investment or the cost benefit just doesn't make sense for the government. And then there's a smaller group of medications, and these are eligible for something called a special authority. So special authorities are an application that your physician makes to Pharmacare requesting that they cover a medication for you.
Right.
Effectively, Pharmacare will have specifies that patients need to try different medications before trying the special authority medications. And once they've tried them, physicians are able to make this application for coverage. Some of the applications are good permanently for the rest of your life. You never have to apply again. Some of them are only for short periods of time. So some are good for 3 months, 6 months, or a year, at which point the doctor needs to reapply every single year. So it can become quite onerous. So once you have a few medications that are like this, you'll definitely have had this conversation with your pharmacist, and your pharmacist is going to work with your physician to make sure that these applications are made in a timely manner. The worst case scenario, and I see a lot of patients come across this, is they need their medication. They might have a few days left, and it's determined that their special authorities run out. The medication's $300, and they're unable to pay for it. So at which point your physician has to get involved. We have to get an application sent through right away, and then Pharmacare has to turn it around in a timely manner, which doesn't always happen, meaning the patient might go without their medications for a certain period of time. So again, really important to have that open conversation with your pharmacist and make sure that they're staying on top of your special authority.
Right.
Really interesting.
Yeah. So
I think what I'm hearing from caregiving, which applies to all all occupations, is that often certain industries or professionals, in a way, you have many individuals that you're servicing, and so it's the responsibility. It's still equally the responsibility of the care recipient or the person taking the medication or the caregiver to ensure that they're being proactive and to advocate to ensure that things are running smoothly. It's not the ownership's not on you as a pharmacist or on the family physician. It's part of your role, but it's how we develop these good cooperative relationships between the healthcare professional, physician, caregiver, and the person actually using the medication. Would you say that that's accurate? Yeah. Okay.
Yeah, definitely. And I think it's really difficult for patients that are unable to advocate for themselves in the current system. Through these special authorities, a lot of people who don't possess the capacity to advocate for themselves really end up going without their medications or end up being unnecessarily financially burdened in comparison to somebody who's able to get these special authorities applied for in a timely manner. And I think finding the right pharmacist and the right pharmacy is key because they're going to help you advocate for the patient. If you're a caregiver, they're going to help you advocate for the patient. If your pharmacist is doing the right job, you never have to worry about any of these issues. They're all working themselves out in the background. So, I think that's really analogous of pharmacy in general. If your pharmacist is doing a good job, you'll never know. But if your pharmacist is doing a bad job, you're definitely going to be giving them a call more often than not.
Mm-hmm. That's super helpful.
It is. Thanks, Jason.
So furthermore, now that we're talking about Pharmacare, we might as well start talking about the third-party drug plans. So third-party drug plans are usually provided through somebody's employer. It might be through a pension. People might have Sun Life or veterans or whatever it is. And after we submit medications to Pharmacare, we then submit them to the third-party drug plan. So third-party drug plans typically have a lot of the same requirements Pharmacare does. So they implicitly cover a lot of medications. They'll generally cover a larger list than Pharmacare. And then there'll be a smaller portion that they won't cover or will require special authorities. So in the situation where a third party requires a special authority, your doctor won't only have to make an application to Pharmacare, but they'll have to make a separate application to the third party generally in order for you to monopolize on all that coverage. So, it can be quite onerous for the physicians, and unfortunately, they're not remunerated for it from either the third party or Pharmacare. So a lot of doctors are doing these, just on the side of their desk and not being paid for it, unfortunately, and they're just doing it for the patient's benefit, which can lead to delays in paperwork because they're not being paid directly for that service, which is a bit unfortunate in the current system. Let's just go through the rest of the slide, making sure I'm not missing anything. So yeah, generally, basically captured all the relevant information there. So after we submit to the third-party drug plan, any remainder is paid for via cash or credit or debit or whatever it is. Bit of change in the rules in and around pharmacy where incentives through air miles, Aeroplan points were removed by the College of Pharmacists a couple of years ago. So a lot of people were able to collect air miles on their prescriptions and are no longer able to do that. Bit of debate as to whether or not that was beneficial, but it's good for patients to know because some of them are totally unaware that that's not the case anymore.
Okay.
All right.
Is there anything else on the slide we good to go?
I think in terms of coverage, unless there's any specific questions, I think we've nailed insurance, so that's good. And I just want to constantly stress that a lot of this information is available through your pharmacist. There's varying degrees of pharmacies out there. You'll have and varying qualities of dispensing. There are pharmacies that treat medications very much as a commodity, and will just try to dispense all medications as quickly as possible. And for the right person, that's the right pharmacy. But for patients who are more complex, if there's multiple caregivers involved, if there's more than just a few medications, if you have personal support workers involved, you're in charge of coordinating refills for somebody or prescriptions, it might be prudent to move to a pharmacy that, spends a little bit more time on that aspect. And typically, if you have a patient that you're taking care of, that has 5+ medications, they're hitting their pharmacare deductible. They're hitting their third-party insurance. So cost doesn't really become relevant whatsoever. One thing I have caregivers always asking me about is, if I have a pharmacy that's got a $5 dispensing fee and I've got a pharmacy that's got a $15 dispensing fee, aren't I going to be paying more at the end of the year? And overwhelmingly, the answer is actually no. So you're going to hit your pharmacare deductible. If you have a pharmacare deductible of $500, you're going to hit that deductible maybe slightly faster with the pharmacy that has a $15 fee than you would with the $5 fee pharmacy. But as a caregiver, taking advantage of the added service and the cognitive service that that pharmacy is probably going to be able to give you will definitely be worth it. And it won't come at any additional cost. So really important, when you decide to choose pharmacies, that you're picking one that works for your specific needs.
So maybe talk a bit about that in terms of, I think, for example, as you mentioned, for some individuals, for caregivers, I'm thinking most caregivers who are on the line, we're dealing with individuals with more complex, or we're dealing with someone who's got, cognitive challenges. So, what are some questions that family caregivers can ask pharmacists to find out, if they're a good fit, or if they end up, providing the scope of support and services that they are looking for? Because
yeah,
I don't think everyone knows that.
And that's a really tough question, and it really comes down to the individual communities. And I don't want to paint any pharmacies with a brush, and if I were to single out some for bad care and some for good care, that might not hold true in your individual community. I do find that if you're able to go in and you can ask an OTC question and you can get a good answer. So let's say you're wanting to find a great pharmacy. Next time you need Tylenol, why not pop into your local pharmacy and ask a few questions about Tylenol? See if you get the pharmacist that comes out to talk to you, or you're getting brushed off and they want to stay behind the dispensary and count as many prescriptions as they can in those hours. And I think approachability is really important too, and feeling that out through a few OTC questions could be really important for caregivers. Also,
right. Okay.
caregivers typically, your doctor is probably another great resource for what pharmacies are good and what they've seen. Other resources would be community health services through your health authority. So if you're accessing through your health authority community health services or home and community care, sometimes it can be called, through the health unit, they can guide you to pharmacies that have a little bit more involvement in patient care and are known for going above and beyond and providing that additional service. So I think that pharmacy service, I think we can separate into two groups. We've got, your typical dispensing services, which,
right.
Blister packs and vials fall into. And then we have more of the cognitive service streams. And, cognitive service can be disease state advice, and it can even be insurance, right? So, because that won't be a really commoditized service. So what I'll do is I'll talk a little bit about the dispensing services and what's available out there, because a lot of people don't know. So typically, when patients are younger, let's say 30s, 40s, 50s, maybe 60s, they'll get their prescriptions dispensed in vials in 90-day supplies. So the reason that we dispense them in 90-day supplies is that's typically what most insurance companies will cover as an absolute maximum. That fluctuates from province to province. So there's some provinces that only cover 30 days at a time. I think in Saskatchewan, if I'm correct, and Quebec, you're only getting 30-day supplies. There's also vials, so non-complex patients that are maybe taking 1 to 3 medications, maybe 1 to 3 times a day, that would be appropriate for. There's also compounding, so a lot of pharmacies will be able to make custom capsules and or creams for patients, and sometimes these are medications that aren't available. Sometimes it's a customized dosage for that individual patient. The capsule only comes in 100 milligrams, and the doctor thinks you need 50, then that's a reason to compound. Also extemporaneous compounds like lotions, creams, suppositories, all this stuff is typically made by your pharmacy. And then another one a lot of people might be familiar with is blister packing or compliance packing or bubble packing. And this is a service that your pharmacy provides, and typically most pharmacies provide it free of charge. So it's when your pharmacist takes all your medications and sorts them in the correct days and the correct times, and they put them in a grid-like blister that you can pop out at the correct time to administer to yourself or the patient. I think this is a great way to keep track of medications for the vast majority of patients. You'll remember if you took a medication. You're not going to fall. You're going to have a very clear picture of how your adherence is. So if you're missing 25% of your medications, you can look back at the end of the week and count them. It just prevents a lot of medication errors. And talking about emergency room visits or adverse drug reactions, so 2/3 of all emergency room visits are medication related. So it could be the dose is too high, could be the dose is too low, could be somebody overdosed, took too much, could be medications that are interacting with each other. And a lot of these are preventable. And to be honest, most adverse drug reactions are preventable. And it's really the communication with the pharmacist and your relationship and the services that they're providing you are going to help reduce those ER visits and complications that can stem from them. So, an interesting concept is the self-observation bias. So, I read an article recently where about 60% of physicians think that their colleagues' prescribing habits are affected by gifts from drug companies, whereas only 10% of physicians think that their own prescribing habits are affected by the gifts they receive from drug companies. This was done in the U.S. The point isn't that it affects their prescribing habits. The point is that you perceive problems with other people less than you perceive problems in your own situation. So every patient that I talk to, I have patients who are 95 years old, and I go to a home visit and say we're going to use the dispensing machine, which I'll talk about in a bit. And, they say, I've never had a problem with my medications. I take them perfectly. And I'm looking around, and there's pills all over the ground, and their daughters behind them shaking their head and mouthing, no, no, no. So everybody is unlikely to see an issue if it's happening to them or their family, or if you're a caregiver. And I think it's really important that caregivers are cognizant of that. And, in order to seek, you should seek these services out before you need them. So if you have, if everything's fine, that's a great time to find a good relationship with a good pharmacist. Because the time that you're going to need that good relationship is after you broke a hip and you've had a hospital stay and you need to be discharged back out in the community. That's not a great time to start a new relationship. The time to start a new relationship was when everything was perfectly fine. So, just to reinforce the seek out help, even if you don't think you need it, because once there's more than a few medications involved at more than a few different times, I think everyone could benefit from, good pharmacist intervention. Talking a little bit more about the dispensing services. So, blister packs used to be like the pinnacle of pharmacy services. I think that was probably a technical revolution that came out maybe in the 1950s, and pharmacy hasn't changed much since then. But now we're really starting to see the proliferation of automated medication dispensing machines. So at our pharmacy, we were the second pharmacy in Canada to start using a machine called Spencer. So Spencer is about the size of a toaster, and it goes into the patient's home, and we deliver a cartridge once a week instead of a blister pack. And this cartridge gets loaded into the machine, and the machine dispenses medication for the patient throughout the day. So it's great for patients' independence. It's great for caregivers. It reduces medication errors, reduces the risk of those adverse drug reactions happening, thereby reducing ER visits. So although they're relatively cutting edge at this point, I think you're going to see those available in your community very shortly. And I really encourage caregivers to take advantage of these machines. Caregivers can be kept in the loop from through cell phone applications that interface directly with the machine. So Spencer, for example, caregivers can download an application on their cell phone, and they can actually ensure that their mom or their dad or whoever they're caring for is taking their medications in real time. So, it might not be important that you take your bisoprolol or your Tylenol exactly at noon, but there's a lot of other information that's available, such as, if somebody didn't take the medication at noon, maybe they experienced a fall, and it allows the caregiver to intervene at that point. There's also some other measurement functionalities like blood glucose. So it can provide real-time blood glucose to the cell phone app as well as the pharmacist or the physician. We can also get weight information. So if somebody's retaining water and they're at risk of congestive heart failure, we can intervene more quickly. So I think a lot of these things are going to be really important and are going to be the standard of care in the next year. So I'd recommend that all caregivers touch base with pharmacies that are going to start offering these services. And I think they're going to be a lot more common than a lot of people think, and especially than they are right now.
So maybe on that note, Jason, what might be helpful is, one of the common questions that we would receive around caregivers calling around, issues on medication are things like compliance, like how do you best report symptoms, and do you report that to your, sometimes it's good to connect with your obviously your physician on those pieces, but sometimes we've got a week or two before that appointment. Is there anything you can do with your pharmacist between that? So it kind of ties into this. Although we're going to this great technology, and there's going to be certain pieces that are going to be sent to the pharmacist directly. What can caregivers do? And maybe talk a bit about things like prescription cascading, polypharmacy. I mean, I think that the more educated caregivers are in terms of what to look for or what to understand can also help, how to give that information back to the pharmacist as well.
Right. Yeah, absolutely. So a lot of our complex patients, we're very involved in their care. It's sometimes our nurses, in a lot of our patients, our nurses visit the patients daily. Our pharmacist is visiting them weekly. We're on the phone with them constantly throughout the week. And your pharmacist is a really good initial contact. So if you have a complex patient, you've got a concern, feel free to call your pharmacist directly. And if the pharmacist thinks that you should go see the physician, then allow them to make that referral for that physician visit. Because in reality, you can save a lot of your own time and you can save a lot of the doctor's time by maybe remedying these concerns with the pharmacist. So for example, let's say I'm experiencing upset stomach, cramping often in the morning. Your pharmacist is going to be able to look at your medications and see if there's any medications that might cause that issue. And in that case, maybe it's moving the dosing time, maybe it's consulting with the physician and asking for a discontinuation if it's no longer necessary. And at that point, if your pharmacist determines that, this is not anything medication related, they're going to recommend you go see your physician. So the message to caregivers would be, if you have a pharmacist involved, call them every time. Your pharmacy is going to be open 12 to 16 hours a day, often 365 days a year. A lot of caregivers can't wait for the answers, and they don't need to waste their time on unnecessary physician visits. And they definitely don't need to waste the physician's time on that either. So, feel free to call us at any time. We're definitely there, and pharmacists are one of the most accessible healthcare professionals. In Victoria, for example, you can walk into 100 pharmacies that are open right now and talk to 100 different pharmacists without an appointment. We have a lot of knowledge, and we're ready to dispense that knowledge. And in quite a few countries and provinces in Canada, pharmacists are prescribing medications, and people generally visit them before they do a walk-in clinic. So I think that role also is going to evolve in BC. We're a little bit behind the other provinces, but I think offering those services is really going to help change caregivers' perceptions of pharmacists as the first place to go.
Right, and so it sounds like maybe I don't want to suggest pharmacists are underutilized. Maybe it's more this shift where caregivers maybe don't see it or don't see them as kind of that first go-to, individual or resource. And I think that's a really good point to be made for family caregivers. Is, as you mentioned, we are looking at ways at trying to have questions answered quickly or determining whether or not we have to go see family physician. So I think that's a really good point in terms of the accessibility piece. I think it also brings up one of the things that we talked about or alluding to later on in the presentation, and then the importance really of that's why you only use one pharmacist.
Right.
Why you don't have several on the go in terms of, it's more convenient to go see this individual on that day, or we just got discharged from hospital, and so we're going to go to this pharmacy because it's really close by on the way home.
Right, yeah, and I'll definitely speak a little bit more to that. So, going to one pharmacist is extremely important. You often have a dentist that you see all the time. You've got a massage therapist that you see all the time, a physician that you see all the time. It's equally important that you maintain all of the records in one place. If your pharmacist is having a look on PharmaNet and analyze interactions and doesn't know you very well, they're not going to be able to give you the best advice. It's not about treating the disease, it's about treating the patient a lot of the times, and what's right for one person may not be the right answer for another person, and the pharmacist is only going to know that after having built that relationship with you as a patient. So, yeah, I would definitely recommend people only see one pharmacist, or one pharmacy, rather.
I know another question that comes up, quite often with individuals, and I think this comes, around the idea of, and I think you can speak to both of these, the idea of not sure, so a caregiver, might report some symptoms at the doctor's appointment, and then the physician looks at, okay, well, we're going to prescribe this medication, but then that medication is being used to treat a symptom that maybe another medication is causing. Or there's so many medications, especially in complex situations, that it's hard to know, which medication is causing which symptom, or is it really working? So what strategies or ideas do you have for family caregivers to kind of help, again, what they're observing and how best to present that information? And is that, again, something they should go to the pharmacist for? Talk a bit about that.
So, yeah, like that's quite a, that's quite a topic. There is, in terms of adverse drug reactions or treating medication side effects with other medications, that happens all too often. Patients are going, they go to the physician for insomnia, they get prescribed the medication, that medication causes dry mouth. They weren't counseled adequately on that side effect, so now they go in and they're getting dry mouth, and they see another physician and they get a prescription for that. And now you have one prescription treating a side effect of another medication, and then, maybe the one that treats dry mouth causes insomnia, and it makes the, starts that whole negative feedback cycle again. So there's so many issues that happen that I couldn't even give a summarized list at all, just because it wouldn't even scratch the surface. But that's just one example of how your pharmacist is going to help you and why that relationship is really important. So in that situation, if you had gone to 2 different doctors and 2 different pharmacists, no one's going to connect those dots. And in a time where family physicians are very hard to come by and a lot of people are going without family physicians, I think it's an important time to institute a family pharmacist. So if you're seeing multiple doctors and multiple walk-in clinics, you've got no one overseeing your care really. And as we see our physicians, more and more stretched, I think it's going to be important for caregivers to advocate for themselves and using that pharmacist as a tool to advocate with. Another thing I wanted to chat about, just wrapping up these dispensing services. So a lot of people have, I'm assuming a lot of caregivers probably utilize blister packs for their patients. And in BC, PharmaCare funds a weekly dispensing of blister packs, which most complex patients utilize. And it could be very beneficial for caregivers if they're unaware of it. So typically in this service, what happens is your pharmacy will dispense your medications for a 7-day supply. And some people say, a week's worth of medications, that's not really that much. Is this really necessary? And I think a lot of the times it is, because if a patient has, 5+ medications, and there's often changes to those medications, that really, it falls on the caregiver to pick those medications up from the pharmacy. If there's a change, they're collecting them from the patient, they're bringing them back to the pharmacy for the change, they're re-delivering them to the patient, and it results in a huge burden on the patients to provide that service all the time. Whereas if you take advantage of weekly dispensing through your pharmacy, typically pharmacies will deliver those blister packs for free on the same day each week, and they can change medications in a relatively quick manner. So if there's a new blood pressure medication or discontinuation, that change can be done without the caregiver's involvement. It'll be changed in the next blister pack and then re-delivered to the patient. And a lot of the times at that point in a weekly blister pack, pharmacies totally take over the prescription, so you typically don't have to pick up prescriptions from the physician anymore. Everything's done by fax from the pharmacy to the physician, and your pharmacist watches out for the refills and will request more refills from the doctor when it's time. So it's called weekly blister packs or weekly dispensing, and it's a hugely valuable service and can really reduce the burden on caregivers. All right, so that really covers off the dispensing portion of a pharmacist's job. And I know we've touched on cognitive services. So like, for example, the most basic cognitive service would be your initial prescription counseling. So typically when you get a prescription from a physician, if it's brand new, your pharmacist is going to say, all right, join me down at the counseling booth. I need to tell you how to take this medication and what side effects to expect. So typically, like, that's going to be the most basic cognitive service, and that's mandated by law from the BC College of Pharmacists, so everyone's going to get that. The other one is going to be med coverage and insurance, and that's really not to be understated, because that's probably the #1 barrier patients have to taking the medications as prescribed by doctors, is the cost element. And it really results, and people that are typically sick don't have high income, so they don't have a lot of disposable income to play with, and medications can be exorbitantly expensive. You know, often medications cost hundreds of dollars a month. So that's really not, you know, something that can be borne by patients or caregivers. Another one that we talked about was disease state advice. So, you know, if there's an issue with your care or with a disease specifically, or you have a question about dry mouth or anything that you could be experiencing, calling your pharmacist is very easy. You know, we're very accessible. And often many visits to the doctor could be headed off, or, you know, could be rushed along by that first phone call with the pharmacist. You know, if you're experiencing like a life-threatening side effect that might seem relatively innocuous at the time, your pharmacist is going to tell you to immediately discontinue that medication and go to see your doctor tomorrow. And conversely, you know, you might just be experiencing a transient side effect that will typically go away within a few days. So you're saving a lot of time that way. Another thing that isn't really talked about is medication interactions. So often medications there's a few different general interactions that can happen. So one medication might entirely negate the effect of another medication. So one that I think about often is Plavix, or a blood thinner that people take to prevent strokes. There's a common medication called proton pump inhibitors that can actually prevent Plavix from doing its job, putting patients at risk of strokes. And these are some of the most common medication classes available. And it's something that patients are entirely unaware of. So that's an important thing that your pharmacist can watch out for. You know, and at the time it seems relatively innocuous to patients. Well, you know, it's just a heartburn medication. What could possibly go wrong? Well, in reality, you know, it could give you a stroke. That's what could go wrong. So that's another thing your pharmacist is going to watch out for as well.
Jason, do you get many people coming in who have, so if the person they're looking after has a family doc and they've been on a regular kind of routine, but then there's some kind of an event, so they end up going to a specialist, and then the specialist prescribes some different medications and doesn't necessarily recommend that the person go back to see their family doc. So now they've got two different sets of meds. Mm-hmm. How often does that come up for you guys? Like, is that something you flag for someone? Or I just, you know, we get calls like that, and I always kind of think, wow, gets so confusing for people.
Yeah, like, so a great example is, so let's say you had a family doc, let's say you have a chronic obstructive pulmonary disorder, or like a respiratory condition, and you're taking a steroid inhaler from your family physician, and you go to the specialist, and you're prescribed a combo inhaler that has a steroid, and it has a bronchodilator in it as well. So maybe the specialist was unaware that you were already prescribed that steroid inhaler, and now are being prescribed the combination. It's really going to be the pharmacist that tells you to stop taking the first inhaler despite not having a discontinuation order from your family doctor or the specialist. So, you know, a bit of a very specific situation, but I think this situation happens over and over. It's all too common. You know, maybe it's not therapeutic duplication. You know, maybe it's a life-threatening interaction. Recently, I had a patient that he had Parkinson's disease, was being prescribed medication from his family physician and a new medication from a specialist. The family physician was prescribing the medication for insomnia. The specialist was providing a medication for Parkinson's. And the family physician didn't think that it was an important drug interaction, and he actually dissuaded the patient from changing the medication because he said, you know, I've seen this interaction before and nobody's died yet. But,
No.
you know, like sometimes drug interactions, it represents an elevated risk, you know. So let's say having a drug interaction is you walking not on the sidewalk and then having that interaction is you jaywalking. Maybe you're not going to get hit by a car, but there is an elevated risk of that, so your pharmacist is probably going to want to keep you on the sidewalk or the crosswalk. So sometimes there's a disparity of opinion, and your pharmacist is going to be able to give you candid advice, and you know, it's not going to hurt. They're not going to try to hurt anybody's ego or feelings or anything like that. But at the end of the day, you know, that patient ended up discontinuing that medication, and you know, he was wary of the discontinuation, and he said, you know, if I was your dad, would you tell me to discontinue it? And I said, absolutely, 100%, no doubt. And he stopped taking it right away. So,
Wow.
you know, and that was really important. And to be honest, he had been taking it for a few years, and it's likely nothing would have happened. But in the unlikely event he did experience a side effect, it's called serotonin syndrome, and it's a fatal syndrome, and I've seen it happen before. You know, he decided, you know, I was able to educate him, and he made the right choice for his care, which was great. And you know, that's what we try to do these days, is we try to educate patients and allow them to make the correct decisions themselves versus us dictating the decision.
Right. Great example. I've got one more that's coming to mind. So if someone's consistently coming to you for their meds, so here's the situation that I've had a couple of calls about, actually. So mom is on meds and has been for years, and it's all going okay, but all of a sudden, you know, she's losing a lot of weight. So just sometimes with seniors, they become frail, and that's what happens, right? But the dosage doesn't change. And, you know, a couple of care recipients that I've talked to start noticing, like they're thinking that they're maybe, if it's pain meds, the prescription is they're over-medicating.
Yeah.
So that would be a really tricky one, right?
You know, and that's really tough. And there's very few physicians that will employ lower doses of medication in the elderly or, you know, patients who have compromised renal impairment, for example. So, like, I think Tylenol is a good example. So everybody knows Tylenol, take 1 to 2 every 4 to 6 hours. And what does everybody do? They take 2 every 4 hours because they are the exception, and they need the highest dose of Tylenol. And that dose is relevant for an 80-pound 12-year-old, and it can be relevant for a 400-pound 40-year-old man. So, you know, obviously they have different needs, but there's very few people that are out there making those adjustments for those specific patient types. And, you know, physicians that I see do a really good job at this are nephrologists. Just to touch a little bit about polypharmacy. So polypharmacy is, it just means multi-drug. And there's actually been a correlated increase in patients experiencing falls and having worse outcomes the more medications they take. So there's been a big push, you know, in the medical community to reduce the amount of prescriptions that patients are prescribed to 4 or less. And you know, and that's been seen to have better outcomes. And you know, there are some exceptions where patients, you know, they need more than 4, and there's nothing we can do. But if we can try everything reasonable to get them down to a lesser amount of medications, they're probably going to be better off. And another thing, just to touch on pain medications. So pain medications, because you said, you know, if somebody rapidly loses weight and they're on pain medications like morphine, you know, could they have too much medication on board? And to be honest, generally the answer is no. So opioid-like medications like morphine, fentanyl, you know, that's been getting a lot of publicity recently. There's also oxycodone or Tylenol 3s or anything like that. They have no dosage ceiling limit. So if you've been titrated and you started on 1 a day and you're now taking 50 a day, as long as you did that slowly, you may not be experiencing any more side effects than you experienced on 1 a day. So opioid doses are very tailored to the individual, and just because one person can take that dose doesn't mean anybody else can take that dose. So you could have a 100-pound 90-year-old taking a dose that could potentially overdose a 200-pound 20-year-old. And
wow.
as long as they were going slow at the time and they titrated it to an appropriate dose, totally fine with them.
Interesting.
Mm-hmm. So I guess one thing that I've certainly found with family caregivers, just sort of along this lines of, we're talking about the whole idea of de-prescribing, trying to reduce number of medications that individuals are on, and I think we're certainly seeing the benefits around that. But I guess one area that caregivers seem to maybe have a challenge with is perhaps I don't want to say going up against their physician or advocating a bit more around like their personal preferences. I think that's an area that sometimes comes up, is that people are they're a bit hesitant to speak up because of the fact that typically physicians or that they're in this position of authority or the expert, but yet they're also concerned about what's actually happening with the number of prescriptions. So that's a bit of a what we find a bit of a real life situation, that hesitancy to speak up or to take initiative.
Well, and to be honest, I've seen people go too far on both sides of that equation. So, I've seen people that don't speak up enough, don't advocate for themselves enough, and then I see caregivers that advocate way too much, and they become way too involved, and they start, meddling in areas that they probably shouldn't be meddling in. And like an example I've seen in the last few months is we had a caregiver who really wanted one of the medications to be discontinued for the patient because they were under the impression that it was causing a specific side effect. And, we had said that it was unlikely that this medication was causing that side effect, and the physician said it was unlikely that it was causing the side effect, but this person was convinced. So the medication ended up getting discontinued, and over the weekend, it was determined that it was not this medication that had been causing that side effect, and the patient had started accumulating fluid because they no longer were prescribed this medication. And unfortunately, on a statutory holiday or a Sunday, your pharmacy might be open, but your doctor's not there to re-prescribe that medication. And it's really outside of the scope of practice for your pharmacy or your pharmacist to reinitiate something like that. So they were in a bit of a bind, and unfortunately for them, it was because they were too involved.
Right.
And on the other side of the equation, I think people could probably err on the side of being more involved than they are right now. I think often prescriptions are written and continued for years and years and years, and they're never reevaluated whether they should be continued, once a year or every 3 months or whatever. You have some patients who were prescribed gabapentin for, a nerve pain that no longer exists, and they've been taking it for years, and what kind of effect has that had on their health, and all of that. So I think it is important to question and have an active, engaged conversation with your physician and your pharmacist, and allow the pharmacist to educate you before your physician visits, and so you can get the most time or the most, have an effective visit with your doctor, and go in there as an educated individual versus just learning at that time. So generally, I'd say err on the side of being more involved, err on the side of questioning, but take a word of advice and don't be that person I described earlier, a few minutes ago. So because that can really be to your detriment and the patient's detriment.
So for the individuals, the caregivers on the line or healthcare professionals If you take a look under the screen, there's a little heading. It says webinar handout. As we've been going through the presentation, we've been covering a fair amount of information, most of which is summarized on the slide, and so you're able to download that file for future use. I just want to bring that to attention because I know we've been sort of going back and forth, which is great for dialogue.
Yeah, good point, Wendy.
Yeah. Yeah.
And also the chat box, because I've been taking notes here, I can make that available as a handout as well. I can get the transcript and make that available because you've covered some really interesting points, Jason, so excellent.
Yeah, and like this webinar, I really hope that it serves as a resource for people to really realize what types of services are available. Like, I haven't touched on everything, and I haven't been comprehensive on everything. I think that this should really serve as a reason that you should go find and make a good relationship with a good pharmacist out there, because this is only a small portion of the services and the knowledge that they're going to be able to give you as a caregiver.
Well, I think I think what you've hit on, which I think maybe as a health, just as someone who works works with many caregivers, I suppose it is similar to other customer-based or client-based services where it is about customer service. And I think that that's an important piece around, as you mentioned, these different types of pharmacies. One thing that perhaps, a couple of caregivers, would mention, for example, is, well, when I go and see the pharmacist, they may not, actively start talking about medication. They might ask me a question where then I start to feel a bit more, I call it put on the spot, like, so you're feeling comfortable with how this medication is, or how you should take this medication. It's a bit more of a, if you say no, then often you feel quite like I don't know what I'm doing as a caregiver. And so often caregivers say yes, because, they don't want to feel like they're not able to do their job, for lack of a better word. So, I mean, that's one bit of feedback. And I think for some caregivers, they're just not sure what to look for. So I think your example of, in a way, taking a look at some different pharmacies and how they interact. So one of my questions, I guess, the other family caregiver is concerned about is like switching pharmacies. So what happens? I've been going to see this pharmacist, and let's say I didn't really realize it's not that great, or moving. What happens? Like, how can you make that transition as best as possible?
Right. So, and there's actually, it's quite regimented. It's called a prescription transfer. So what you would do as a caregiver, if you decided you'd like care from a different pharmacy, you contact the pharmacy you would like care from, and then you ask them to transfer your prescriptions from the pharmacy that they currently reside at. The pharmacist would take some information, probably phone number, address, information, allergies, etc., and they reach out to that pharmacist, and they provide a handoff. So they fax over all the relevant prescriptions, and then they fax over any relevant notes as well on the patient. And then they also have a bit of a communication about the patient to make sure that they're handing off care appropriately. So, it is a relatively easy process, and all you have to do is you just have to call the pharmacy that you would like to go to and ask for a prescription transfer, and they'll take everything from there.
Wow, that's a lot easier than I would have thought.
Yeah, most people just don't know.
Mm-hmm.
And it's almost instantaneous. Like with the computer systems these days, you just press a button and say transfer. Like say transfer to Shoppers Drug Mart, and it automatically faxes all the information over there. So they get it, within 15 minutes, the entire patient profile.
Interesting. Okay.
The only medications that can't be transferred are controlled prescriptions like narcotics. So, if you have a Tylenol-free prescription on file, you're not going to be able to transfer that. You'll need a new prescription from the doctor.
Okay.
Yeah.
And I also understand too. I was just taking a look at the slides just to make sure we're covering off some of the major points that we're receiving from family caregivers as well. And so maybe I think sometimes we think this information is really well known, but like a couple things I'll just list off in terms of like medication management. So of course this idea of returning expired medications or unused, we don't throw them in the garbage. I think most people understand that.
Right. There is something I'd like to mention about that.
Yes.
So medications, we have to, so every pharmacy participates in something called the BC Medication Return Program. And in that, when you return prescriptions to the pharmacy, most pharmacies prefer that you pour them in a clear Ziploc bag, and then that clear Ziploc bag can be tossed in the BC Med return bin. If you return them in blister packs, that means that one of the staff has to punch all those individual things out, shred the patient information. So it really turns into like quite an arduous process for the pharmacy. So if you can just put them all in a baggie, every pharmacist is going to love you.
Not mixed all together, though.
They're going to be happy about that.
You can mix them all together, so that you can
Okay.
You can throw them all in a bag and bring them right to the pharmacy, and we'll just take them like that.
Because they're just being thrown out. Obviously. So, I guess the other thing that relates to this idea of before you go to your physician, most people presumably know that the current list of medications, but from what I understand too is that the pharmacy will happily fax over that list of medications prior to a physician visit.
Yeah, absolutely.
Yeah.
So this often takes place before specialist visits. If you're seeing a new dentist for the first time or something like that, and they're unaware of what you're taking, they'll ask us to fax something over. Typically, your family doctor's got a really good idea of what you're already taking, so they shouldn't require that. But it's a service available if you need it.
Well, you know what I have found, honestly, sometimes what happens is, so I think about complex medical situations. I'll just give you an example. Family caregivers caring for, 94-year-old mom. She's, is having some issues, falls, was hospitalized. At the hospital, upon discharge, ED, gave her a new prescription because they were concerned about dosage. So then that was changed. They went and filled that in, at the pharmacy. She had a follow-up doctor's appointment 3 days later. And had the caregiver not really been sort of on top of all those changes, although the physician was really hands-on, really good, it was kind of this back and forth with ER, with visits and changes, and there had been previous changes. So it was actually really quite, in terms of a timeline, understanding, some of those changes in medications was helpful for the caregiver to know, sort of what happened at hospital like discharge or ER discharge. And I think that that's often a time that's very, that's an area of high risk, especially with complex. So sometimes it's great to have that current list, but it's also good to know how that list changed from the previous one.
Yeah, and we typically call those transition points. So if a patient's been admitted to hospital, discharged from hospital, goes to residential care, they go to respite, they've changed doctors. Those are points where inadvertent changes can happen and detrimental changes can happen. So that's usually a time where we're taking the most care in dispensing some of these prescriptions. Just knowing that there could be a lot of issues with the prescription, and there often is.
While we're on inadvertent changes, can we? I don't want to spend too much time on this, but I think one of the questions that we get often from family caregivers who are caring for an aging relative or a spouse in residential care is the role of the pharmacist in that setting. But also that idea of these inadvertent changes, or sometimes medications are given based on behavior or particular situations.
Yeah.
Talk a bit about that role and how caregivers can, again, help themselves in ensuring that they're being the best advocate possible.
So residential care is an entirely different beast. So it's in a residential care facility, the facility will sign a contract with one pharmacy, and typically those pharmacies are specialized just to provide services to residential care facilities like that. So they don't typically dispense medications in vials. These aren't places you can go visit. They're usually in warehouses, and they deliver to the facility. There is a mandate in BC, and these are the BC College of Pharmacists regulations, that a pharmacist has to participate in some sort of medication review on site in a care conference-like setting every 6 months. So in a lot of facilities, patients, caregivers can attend these as well, and they can actually talk to the pharmacist directly. Sometimes the doctors are there, sometimes they're not. But, you know, that's a good, because often what happens in residential care is these pharmacies are dispensing so many medications, and so many patients are getting medications, and they're not advocating for themselves. It really gives pharmacists a good opportunity to sit down and say, all right, should this person be on this prescription at this time, or has this just been ordered inadvertently and continued inadvertently for an extended period of time in an unwarranted fashion? So for an example, like something that might be caught at that would be, let's say the patient had gastroenteritis, they had some diarrhea, they had cramping, and they were prescribed an antispasmodic to be taken for a short period of time. But the prescription got inadvertently renewed, and now they've been taking it for 5 months, and they don't need it. So that's an opportunity for the pharmacist to take a look at that and say, well, you know what, this probably shouldn't be continued, and let's discontinue it. So that's what those care conferences are for, and caregivers should feel welcome to attend those.
Okay. I think that's important for caregivers to know that difference between the two.
Yeah, and a lot of those residential care patients really lack advocacy. So, you know, although the caregiver is probably not directly involved in the care, like they should probably be involved in the advocacy quite heavily, because often that's all they have. That's all the patient has.
Yeah, well, caregivers actually are quite still hands-on in much of the care and residential care facilities, but I think there's maybe a lack of understanding about how medications are. I think most people understand how they're administered, but I don't think they understand how they're, you know, controlled or how they're renewed or how that whole piece works. So I think it's good for people to understand that there's two separate systems essentially in terms of you know, the role of a pharmacist and the idea of care conferences and the importance of attending those and asking questions around the medication.
Absolutely, for sure.
So I'm just going to jump in here and invite our participants. If any of you have any questions, I hope you will be feel free to type them into the chat box, because we've kept Jason pretty busy here, but maybe you have some specific questions. It's certainly a hot topic. I really I think this will be very helpful, Jason. And I didn't mention, and I should have, that this webinar is being recorded, so it becomes one of our resources on our website, and we continually direct people to useful webinars like this to help. Hope it does expand across the province, because it certainly could be one of the solutions. No question about that.
Absolutely.
So, Wendy, any final thoughts from you?
I think it's been a really great, informative webinar, and I can see us bringing up some valuable points as we're connecting with family caregivers. It really kind of helps clarify and highlight the importance of having a pharmacist that meets you where you need to be met on your team. So thanks, Jason.
Yeah, thank you so much, Jason. Like Wendy said, I think this will be an amazing resource for us, and I hope the folks who joined us tonight have certainly taken away some tips. As we've got this poll here, how many of you will now approach a pharmacist in your role as a caregiver? So I hope that's 100%. I know I've learned a lot myself. So Jason, really appreciate you doing this for us, and there's an article in our fall issue of Caregiver Connection about Jason and his pharmacy here in Victoria, so definitely check that out. You can find that on our website along with all of our other resources, and this webinar recording will be up within probably by early next week. So Jason, thank you so much for joining us, and Wendy, thank you as always for your wonderful insights and questions. And with that, I'm going to